Why are we still having such cases in this day and age?
It's a good question to ask. If I recall, in 2009 we had similar cases, if you recall, in Eastern Cape in 2010, in Charlotte Maxeke in Gauteng, and now Limpopo. When we assessed our health system in the past few years, we're struggling largely with quality. And quality aspect deal with management, infrastructure, access to proper working equipment, competent staff. So it's a multiple problems. But there are systemic failures in the system which have to be resolved over a number of years. I don't think that it's something that we can solve over a period. But the Limpopo case is a disturbing one.
Yeah.
Disturbing in that you can't, health is an essential service. You can't shut down and say everybody goes on leave, from not only hospital workers, but also the administrative staff in the districts and in the provincial health department.
Yeah.
It's unheard of. There are always contingency measures put in place, and in case of emergency, you must have some backup of some sort.
Yeah, but this
was not the case.
This was not the case. So what is going to happen? I mean, when you look at a case like this, 4 lives have been lost, innocent lives, and it's unacceptable.
Precisely.
So what is going to happen?
The first is that we have what we call committees that investigate deaths, maternal deaths in hospitals. These are ministerial committees. They've been in existence for years. They are chaired by different experts, and they meet regularly. They go from facility to facility to look at the causes of death, maternal deaths, perinatal deaths, children's deaths, and so on. So the minister appointed a small committee to immediately deal with this matter. It is led by Professor Neil Mekero, who is actually the chair of the a committee on pediatric deaths.
Yeah.
It's a committee of 3. It also has a neonatologist. 2 of the babies that died were actually newborns. So we need the neonatologist to understand what the problems are. I think there are 2 problems that I think we need to investigate. And the first, and these deal with governance, clinical governance and overall administrative governance. Because in most instances, even though you have management failures, you must have a governance structure like a board, a functional board.
Yeah.
We're supposed to be having functional hospital boards in all our hospitals. We're supposed to be having clinical management committees for the proper governance of these institutions. And for that reasons, we've identified these are required by law. They're not optional. The National Health Act requires that every institution have these.
Yeah.
But some of these institutions are supposed to be established by the provincial management executive committees, the MECs. For the central hospitals, and you probably heard the minister has been talking a lot about the central hospitals, the minister must appoint those. And it's for that reason the minister has taken on board this notion that central hospitals must be centralized. But with regard to Limpopo, there are a multiple systems failure. This is how I can describe that.
It's worrying, though, that from the national department that all of this is happening, and it appears that you're not aware of all of this. And that is a worrying thing, because, I mean, constantly, I think, the use of supposed to, the word supposed to be doing, but it's not happening, and that's the reality. You know, when is the Department of Health going to get its ducks in a row? Because this always seems to be the case. I mean, we're relaying stories from 2009. Same thing is happening. We're sitting in 2013. Something dramatic has to be done in the health sector.
Something dramatic is the law that must come into force this year.
And it will come into force this year?
It will, because it has been passed by the National Council of Provinces. So once the National Assembly passes the law, it comes into force, we're going to hold people accountable. Because at the moment there are no consequences, but this one requires that everybody accounts and everybody implements the standards. We have come up with norms and standards. We are setting up an Office of Health Standard Compliance. And what is important about this is that the ombudsperson, this is what Parliament has requested, must report directly to Parliament. So this is the level at which this body will function.
Yeah. You know, in terms of leave, and we look at the hospital, I mean, are there certain, what are the procedures that should be followed in terms of leave? Because, you know, a situation like this cannot possibly be allowed once again. But I mean, what is the general rule?
Let me describe a hospital setting in 5 key areas. You know, a hospital must have 5 key functional areas. The first one is the hospitality area. This is ensuring that patients have food, the hospital is clean, your laundry services are in order, and so on, and you have security. This is one. Like you take a hotel, that's the hospitality aspect of a hospital. That's how it should be. The second area is about clinical services. This is where your doctors and nurses must ensure that there's patient care and clinical governance. The third is about administration. These are the people who must ensure that you've got staff, you've got computers that are working, your files are in order, your patients can be addressed on time, there are queue marshals and so on. This is administration. Then it's governance. These are your oversight bodies, your hospital boards. Now, in terms of this Office of Health Standard Compliance, we've trained inspectors. Now, inspectors are going to go to every single facility. So far, just on a mock basis, we've actually inspected 100 facilities. And we say if that law was already in place, most of them would have failed and would be taking action. Now, taking action, we don't have a legal mandate to take action. But now with this law, we'll do so this year.
Yeah. Well, we can hope that it's going to be happening this year and very, very fast, because, I mean, there's just a general perception out there that, I mean, we're taking a look at what's happened now, but it's taken the lives of 4 babies to be able to talk about something like this. But it's something that needs to
avoidable,
move faster. Yeah,
preventable deaths,
and that's what's most important.
Exactly.
So, I mean, the minister is taking something like this very, very seriously.
Indeed. In fact, there's a team reporting directly to the minister. These are systems that we're putting in place. The National Health Act was passed in 2003, but it did not come into force. The minister made sure that this past year in March, it came into force. And this is what is enabling us to put these systems in place. Yeah. You can't have a law that is on paper only. The law has to be enforced.
Well, thank you very much for talking to us. Precious Matsotso is the DG for the National Health, and talking about this very sad story out of Limpopo, the George Masebe Hospital, 4 babies that died due to the fact that the staff were on leave and nobody could assist them, and that is a problem. And
just in conclusion, I mean, this is clinical negligence, which is deplorable. Yeah. But I think for the parents, we send our warm sympathies, and any child, any mother, any father that loses a child, it's painful. There's no way you can describe the pain. Yeah. But this is important. We need to prevent this. We should never have this again, not in this country.
No, well with that we can hope.